Thank you very much, Clementine. Good morning, everyone. A warm welcome to this EU HPPP live webinar on climate resilience, the role of the healthcare sector. This webinar is being co-organized by the International Association of Mutual Benefit Societies, the European Federation of Allergy and Airways Disease Patients Association, the Standing Committee of European Doctors, the European Hospital and Healthcare Federation, the Health and Environment Alliance, and the EU Commission. My name is Anne Stauffer. I'm Deputy Director at HEAL, the Health and Environment Alliance, an alliance of over 80 member organizations working for better health through a healthy environment. And it's my pleasure to see all of you here today. HEAL was one of the first organizations in Brussels to raise the link between health and climate change, to actually highlight that health needs to be at the center of EU climate action back in 2008. Back then, we were a handful of health people from the health sector, including WHO, to make that link. A lot has changed since then, in this decade since, in the health and healthcare sector, with now thousands of individuals and organizations engaged on climate mitigation and adaptation. And I think that today's webinar is proof of this high level of interest, of engagement in the health and healthcare sector, with over 280 registrations. Thanks everyone for taking the time this morning on this important topic. I would say that in the health sector, it is by now apparent that climate change is the biggest health threat of the 21st century, threatening the health and well-being of every European, and especially those most at risk, including the elderly, including patients, children, and those facing health inequalities. And also, with the climate crisis, with the pace that the European continent is heating up, it's heating up much faster than other regions in the world. This brings major challenges also to the healthcare sector when it comes to adapting, for example, with hospital buildings, but also when it comes to reducing the sector's own climate footprint. And also the climate crisis is challenging the effectiveness and sustainability of healthcare systems. Probably everyone here joining this morning agrees that we need to strengthen our climate resilience. But how do we actually do this? What kind of policy action is needed? Is the level of awareness among policymakers on the health challenges adequate? And what is the role of the health and healthcare sector in all of it? You see that there are a lot of questions, and with today's webinar, we want to deep dive into some of them, into talking about climate resilience and health. And I'm very pleased that with this morning, we'll hear from a range of experts on the topic. We'll start with a presentation on the recent UCRA report, the first ever EU climate risk assessment report. We'll hear some insights from the Belgian EU presidency and action that has been taken at Belgian level. And then we'll last but not least come to a panel discussion with some of our distinguished experts from AIM, CPME, EFA, and HOPE. And we also do want to very much make this an interactive session this morning. So hear about your questions and about your concerns. And with this, you can actually use the chat function, which you find on your bottom right, where you can type in your questions and comments, and then we will see that we can come to them as part of the panel discussion. So before we start, I also want to come back to the housekeeping. I just mentioned for you the opportunity to engage via the chat function. This webinar is being recorded and is then made available afterwards, as will also the slides be made available. And if you have any technical problems, if you need any technical support, please do contact Wendy from the technical support, who will assist you with any problems there. And with that, I would say, let's get going. Let's start with our first presentation. And I would like to give a warm welcome to Mr. Peter Löffler from the European Commission, from the DG on climate adaptation. You're a policy officer there, Peter, and focusing actually on climate and health adaptation, on the European Climate and Health Observatory, and on Climate Adapt, among some other things. And you will kick us off here this morning on giving us the summary and the snapshot on the European Climate Risk Assessment. Thank you very much for joining, Peter, and the floor is yours.
Many thanks, Anne. Wonderful morning to everyone. At least it's a brilliant, bright morning here in Brussels. Thank you very much to Anne and to the co-host for having me today, for giving me the floor. Welcome also to Evelyn from the Belgian presidency, and thanks for your great work on climate adaptation. And to the other panelists and to the participants of this webinar. I'll outline the EU climate risk assessment, but I will also talk a bit about the climate and health context overall, the policy context, and some other recent developments. So policy context first. I'm from the Climate Action Director General of the Commission, and why is someone like me in a health webinar? Well, it comes down to our commitment to make the EU climate neutral by 2050, and we are just about to raise our proposed target to reduce greenhouse gas emissions from minus 55% by 2030 to minus 90% by 2040. And for this objective, health is a key driver underpinning our ambition. And let me also here say that the health sector is one of the big emitters of greenhouse gases. But essentially, we see health as a key driver for climate policy. We also see climate policy as a major contributor to public health. And this is a lot linked to the fact that if we move to a climate neutral and clean energy future, we will have significant health co-benefits from avoiding the worst climate change scenarios, but also from realizing short-term gains from reducing air pollutants and improved air quality. However fast we cut greenhouse gases emissions and advance on climate neutrality, the sad fact is that climate change has started already. It is accelerating, and we will have it at least throughout this century. April has been again the warmest April on record this year. 2023 was the warmest, joint warmest year on record globally. Sea level temperature has reached 5.5 degrees above average compared to pre-industrial times. And last year was also a year of contrast, not just with a lot of heat, but also with record precipitation. So it's a quite uncertain future, but I think it doesn't require a lot of fantasy to see how this graph will, which you see here on the screen, will continue in the future. And it's been said a lot of time, and we fully agree with that. The climate change is a formidable challenge for public health. Climate change is a risk multiplier. You see, Sarah, how it works on the slide here, affecting heat extremes, infectious diseases, wildfires, food and water safety issues. It does already have mental health impacts. It has systemic impacts on health and care systems. And of course, vulnerable groups will be affected first. There is a lot of rubbish, really, and distorted messages on climate change flying around in social media bubbles. But the fact is, and we do know this from our representative Eurobarometer surveys, that a large majority of EU citizens are concerned about climate change. They see it as a very serious problem. And interestingly, even though in Europe we are fairly well protected when it comes to health impacts, 4 out of 10 people already feel personally exposed to climate risks. So there's a big public concern. And this is also echoed by the reports which we get from the EU member states. What you see here is a graph which is based on the adaptation policy reporting of from the EU member states from last year. And of all sectors affected by climate change, in the view of EU member states, health is the #1 sector. So this is the most affected sector by climate change of all. And I said it already, climate adaptation and preparedness and it links to health have made sort of a formidable development in the last few years. We have seen it was like a shooting star, really. In adaptation policy, health has come up a lot, and it has been rising and is big on the political agenda now. What you see on this slide here is just the policy framework related to climate adaptation, not mitigation. And it reaches from the international levels where we have now the global goal on adaptation, including health-related targets. Last year's COP28 declaration on climate health, the so-called Belém framework adopted in Budapest last year under the Budapest declaration adopted last year, and the so-called Belém framework to develop indicators on adaptation, including on health. At the EU level, when it comes to health policy, we have the Global Health Strategy, there is the regulation on cross-border health threats, the communication on mental health, to name but a few initiatives. In my field, climate adaptation, we have the European Climate Law from 2021, the EU Adaptation Strategy from 2021, and both of them sort of enact a duty to adapt to climate change and to make adaptation smarter, faster, and more systemic. And also launched in 2021, our European Climate and Health Observatory aims to provide us with the knowledge, the tools, and the capacity building to address the climate and health challenge. And finally, at the beginning of this year, so we had the publication of the latest initiatives in this sort of in this field with the European Climate Risk Assessment and our communication on managing climate risks. And this is what I'm going to present now. Now, EU Climate Risk Assessment, what is it? It is a commitment under which we sort of put into our adaptation strategy from 2021. It's the first ever EU level systemic look into climate-related risks for Europe as a whole. It was a fairly fast track assessment, took only 1.5 years, which for an assessment of the type is fairly fast-paced. So it was expert-driven and evidence-based, but didn't sort of do its sort of own investigations, or it was a desktop study, if you want. It did involve us in the European Commission, but it's been conducted by the European Environment Agency. Other stakeholders were involved. As I said, the quest was to identify major risks per system and across systems and sectors. One of the aims was to prioritize the risks and the need for action. And the executive summary and an unformatted full report have already been published in March, and the fully formatted final report will be published in the course of this month. The climate risk assessment builds on the climate scenarios, which you see here on this slide. Essentially, as I said before, global and European warming will be accelerating, depending on the greenhouse gas emissions scenarios, more or less strongly. For Europe, the fact is that our continent is warming twice as fast as other world regions. And depending on the emissions scenarios for Europe, we can expect by the end of the century a future where we have average temperatures 2.5 degrees above pre-industrial levels, up to 7 degrees above the pre-industrial levels. And of course, these are only average values. The extremes will increase much faster and much more strongly. So this is a 7 degrees scenario will certainly be a total disaster, but also 2.5 will be a huge challenge. The EU climate risk assessment showed that the climatic risk drivers, what we call climate hazards, really, the hot weather, the precipitation and all that, the storms, will be accelerating everywhere. So we will have heat waves that get worse, rain patterns that are changing, sea level rise will accelerate. And whilst this is true for the whole of Europe, there are some hotspot regions such as Southern Europe, low-lying coastal regions, and also the EU outermost regions. One important matter that the EU climate risk assessment did draw our attention to, and this is something which we experience in climate adaptation overall, that climate risks are systemic risks. We call them systemic or cascading or compounding risks, and there's a bit of a different terminology flying around, but essentially this is about how risks are interconnect across various systems and issues, and that they combine in space and time and multiply sometimes their effects. And examples for this phenomenon in the health sector would be that, if you think of a heat wave, and that may trigger a power cut, and the power cut affects the hospitals, and you can't cool the hospital anymore if it has air conditioning in the first instance. And you may have just your emergency power, for operations and all that. Another cascading risk would be if a heat wave or a flood or a flash flood affects a health system that is already under pressure. An example would be, the summer 2022, when hospitalizations in Malta during the heat waves doubled, whilst the hospital staff was, of course, also stressed by the heat. Heat waves do reduce labor productivity, or another interesting thing which was new to me is that we need to revise the blood safety protocol because of the arrival of new infectious diseases due to climate change. So these are all sort of things which we didn't really always have on our plate, and there's a big space for surprise under climate change, and we need to be prepared for compounding risks. The EU climate risk assessment focused on a couple of themes and storylines which try to bring out these compounding risks, which I just mentioned. There is a thematic fact sheet on human health. And if you look at the risk storylines, there is a risk storyline on infectious diseases and extreme heat. But actually, all of these storylines implicitly, explicitly, indirectly, or directly do have a health component in them. So I didn't really put a circle around any of them because all of them will have effects also on health. What we can say from, and this is the judgment of the experts which have helped us with the EU climate risk assessment, health is impacted in many ways, and there are both individual and systemic risks, but heat stress is certainly, for the time being, in the judgment of the experts, the largest and most urgent risk. I'm thinking just of the 60,000+ deaths in 2023. Also quite a lot of emphasis on wildfires, and we will, the southern European wildfires are coming to Central Europe as the weather gets warmer. And wildfires can exacerbate these risks, amongst other things, through highly toxic contamination, air contamination, the fumes. And we will also need to prepare for the arrival and the spread of climate-sensitive vector and waterborne diseases like, West Nile virus, dengue, chikungunya, Campylobacter, Vibrio infections in the Baltic Sea, Salmonella, and so on. So, what's the political reaction to that? And really, the EU climate risk assessment has given a stark warning, and also our own assessments based on member states report that Europe is really not prepared enough for climate change, and this is certainly also true for the health sector. Several climate risks identified in the EU climate risk assessment are already critical, others are growing, and if we do not address those risks, all of them will become critical in the course of this century. Most of these risks are co-owned by EU and its member states, and I'll come back to that in a second. But essentially, really, climate adaptation and preparedness are not yet keeping pace. We will need stronger policies and more urgent action to manage key risks, and an integrated policy approach is essential. And again, health is a very horizontal cross-cutting theme, which can drive climate adaptation in many different areas. But coming back to the idea of co-owned risks, it is true that many of these risks are owned by member states and are a responsibility of member states to address. But we also do certainly see an EU role in addressing these risks, and we will need to work across all policy levels in conjunction, in tandem with member states and regional and local levels if we are to address them. So we have published in the Commission, together with the EU climate risk assessment, our communication on managing climate risk. This is a communication which represents our sort of political reaction to the findings of our initial political reaction to the findings of the climate risk assessment. The communication focuses on the EU. It demonstrates our readiness to respond. It's been written during the end of the mandate of this current Commission. So we focused a lot on good decision making and solutions. And certainly as the new Commission will take office later this year, we expect the future Commission also to take action. The introductory chapter focused very much on the increasing climate risk assessments. You have seen this graph already. The public demands that we need to work on climate adaptation mitigation. We do not start from scratch, and the good news is that policymakers do have agencies and that risks can be managed. The analysis chapter, chapter 2, focuses very much on the growing risks and the interconnectedness of the risks, which I have been outlining already before. Chapter 2 also says something about uncertainties and probabilities. Climate scenarios are a useful indication of likely outcomes, but because risks compound and because there's scope for surprises, they don't account for tail risks, and these matter. And we need to be aware of climate tipping points. And certainly the uncertainty isn't a valid excuse for inaction. The solution space, let me just highlight 3 things that matter a lot for health: the greater clarity about responsibilities, the need for better models and scenarios, and we need to use the high-end scenarios now for modeling. And financial resilience is a very important point, because I don't think this has been discussed in the health sector a lot, but we will need to improve our addressing health risks also from a financial point of view. You see on this slides the key actions on health as they are in the communication. A lot of focus on workers, surveillance, European Climate and Health Observatory, cross-border risks, and medical countermeasures. But these are the risks just in the health cluster, and in many other areas, actions are also health relevant. For example, systemic risks on building or urban planning. This communication will not be an endpoint. We will take it to international policy also. And as I said, the new commission will take office in the second half of this year. And we would expect, and we do hope, and we would see the future commission also in a capacity to take the next steps on this journey. Thank you very much for your attention. I hope this was interesting, and back to you, Anne.
Thank you very much, Peter. Thank you for this excellent kickoff of our morning's topic and for highlighting the impacts we're already seeing in health, but also what's at stake when we look to health and health protection in climate change. I have to say that, I mean, I've obviously, read the report and seen this analysis, but every time I hear it, it loses nothing of its concern and nothing, as you say, it was, it's really a red alert and a wake-up call for the health sector, but also very much for policymakers and for the public. And thank you for highlighting as well some of the policy responses that the EU has been taking and which we'll further talk about in the course of this morning. I would like to remind all of you participants that we very much like to hear from you with your comments and your questions, and you can put them in the chat, which is at the bottom of your screen. And we will now turn into a second intervention for this morning from Dr. Evelyn de Costa. Warm welcome to you. Evelyn is a strategic advisor at the Belgian Minister of Climate, Environment, Sustainable Development, and the Green Deal. And Evelyn, you're also still practicing in parallel as a medical doctor, as you have a background in dermatology and in venerology and an MA in science for global health. So you very much bring together both the political perspective, but also, if you want, the clinical, the practical health perspective. And we're very much looking forward to hearing from you now the insights into the Belgian EU presidency, but also the action that Belgium has taken on strengthening climate and health resilience. The floor is yours.
Thank you, Anne, and thank you, Peter, for the nice introduction and presentation. And Peter, to answer your question, it was absolutely very interesting, your presentation. It really sets the scene and reminds us of the urgency to act. So, dear ladies and gentlemen, allow me to start with a throwback to a couple of years ago. When my Minister Khattabi, took office, she sent out a tweet, and you can see the tweet. Normally, you should see it on the screen. It says, "Climate change, it's not a question of belief. It is about science." And it's a picture of an art piece by Banksy showing written on a wall, "I don't believe in global warming." And this says it all, I think. It's not a question about believing. Climate change poses one of the most significant challenges of our time, with far-reaching implications for human health and also for the health sector. So I'm therefore very honored to participate in today's webinar concerning the role of the health sector in climate resilience as a representative of the Belgian Federal Minister. But even more than that, I'm here today as a concerned healthcare professional. And I really want to emphasize the importance of the health sector to participate in the climate debate and to take action. The European Environment Agency that has published a UCRA report a couple of weeks ago. It was presented to us by Peter. I'm not going to go into it too in depth because he presented it quite very well, actually. So not surprisingly, the report underlines that health is impacted in many ways by climate change, both at the individual level and through systemic risks to the health system. I'm going to repeat here what Peter said, but it cannot be repeated enough. Extreme weather events such as heat waves, wildfires, floods, storm, they all cause climate-related death, illness, and suffering. Communicable diseases are exacerbated, while global warming alters the spread of patterns of infectious diseases. The tiger mosquito, for example, has already established itself in several European countries, with cases of local transmission of dengue and chikungunya in France and Italy, among others. Closer to home, here in Belgium, last year we have noted the tiger mosquitoes were observed at 25 locations, according to a report published by Cienzano. This is really frightening. As stated in the latest IPCC synthesis report, every increment of global warming will intensify multiple and concurrent hazards, including in terms of health. So the question is no longer, will we need to act? The question is now how we will need to adapt and how we will need to mitigate to become more resilient for climate change. And this is true for the whole of society, but especially for us as a healthcare sector, because we will be the first to be confronted with the devastating impact of climate change. This is also what Peter has showed us in the previous presentation. And let us not also forget that we have an important role when it comes to climate mitigation. Did you know that the health sector is responsible for 4 to 5% of global greenhouse gas emissions? Initial rough estimates suggest that it is even higher here in Belgium. So also the healthcare sector will need to change. We will need to become more resilient. And this will include both mitigation as well as adaptation. We cannot just point at other sectors. And I am very happy to notice that there is a growing understanding within the health sector to become more engaged. There was the example last year at the 28th Conference of the Parties to the United Nations Framework Convention on Climate Change, the COP. There was for the first time a COP28 held day. Going back even further at COP26, Belgium already committed to evolving towards a low carbon, sustainable and climate resilient health system. Meanwhile, other international commitments have been made, for example, in the Budapest Declaration initiative of the WHO European region. But commitments, we cannot stop there. There's an urgency to act because climate change is already there. And we have already seen the impact of climate change during the devastating floods that struck Belgium, Germany, and the Netherlands in July 2021, for example. It triggered the federal government decision to create a Center for Risk Analysis related to climate to report to the National Security Council about the risks associated with climate change, and more broadly also to other planetary boundaries. This body, created on Minister Kadabi's initiative, will provide for mid to long-term and multidisciplinary risk assessments, taking into account not only the hazards our society will face, but also exposure and vulnerability of households and sectors. This institute is called CIRAC. CIRAC is preparing its first comprehensive risk assessment starting in the second half of 2024, this year. For Belgium, a very densely populated and low-lying country, the implications of the risks UCRA emphasized are dire. The country's geographical location exposes us to a variety of climate-related hazards, including flooding from rivers and coastal inundation, as well as heat waves and droughts. Cities like Brussels, Antwerp, Ghent, they are all vulnerable to urban heat islands, where densely built environments and limited green spaces exacerbate the effects of rising temperatures. Belgium faces a critical imperative to strengthen its resilience and adaptability to climate change, but must also inform these actions by sound national risk assessment, and that is where CIRAC is for. Simultaneously, we have taken other steps. We have taken significant strides in enhancing climate resilience of the health sector. The 2021 report on the impact of climate change on our healthcare system has informed policies, while the National Crisis Centre's risk assessment considers climate-influenced risk. The National Adaptation Plan and the National Environment Health Action Plan, short NEHAP, focuses on concrete actions for resilience, adaptation, and the fight against climate change, like exotic mosquito surveillance and heat wave response. We are very proud of this NEHAP. Together with Healthcare Without Harm and Arab, we are currently assessing the baseline carbon emissions of our health system, which will be the basis of a roadmap towards decarbonization of healthcare. On a regional level, several initiatives have been taken to increase adaptation and to lower emissions. Also, green roofs for hospital buildings, for example. And let me finally end by emphasizing that Environmental challenges such as climate change, environmental pollution, and biodiversity loss are intertwined crises. They require an integrated response because they directly and indirectly impact our human health and well-being. It's not just about climate change, it's much broader than that. And it's actually the perfect example of One Health. It's about recognizing the interconnectedness of human health, domestic and wild animal health, plant health, and the wider environment, including ecosystems. We should no longer be talking about health in all policies. We should be talking about One Health in all policies and break down the existing silos and integrate environment much more into whatever we are doing. We should, for example, not forget sociology and psychology as well. They can help us foster behavioral changes. And behavioral changes, they will be necessary and they will be difficult, but we need them. We need them to guide us through this transition. And we should also make sure that our ecological transition is also a just transition. We don't want to leave anyone behind. We should make sure that we leave no one and no place behind. This is also all reflected in our work during the current Belgian presidency of the EU. Within the Environment Council, we support the work on the EU's Green Deal policy initiatives while embracing the One World, One Health approach and taking forward this endeavor in the next strategic agenda. Circular economy, climate adaptation and resilience, and a just transition are our key priorities, recognizing their indirect and direct impact on both climate and health. We have many challenges ahead of us, especially as a health sector, both when it comes to mitigation as well as adaptation. And this is why I welcome with great interest this event. The health sector will need to rise to the challenge of climate change and to build a safer, healthier, and more resilient future for all. Thank you for listening, and I hope you have a very interesting morning with all the presentations following.
Thank you very much, Evelyn, for this very nice example also of interconnectedness. You spoke about the interconnectedness, very nice complementing what Peter was talking about in the kickoff presentation, as you spoke about the solutions part at the action that has been taken at the Belgian national level. But you also reminded us, and that's also why it's connecting to the panel discussion, you reminded us about the need for the health sector to be engaged, and if you want, lead by example, and also for the actions that need to be taken or can be taken in the health sector as really for against this crucial challenge and this unique threat that we're faced with the climate crisis. So I would now like to turn to our panel to go deeper into some of the issues that were raised this morning, including the finance side. I see there's a question in the chat on finance, so I'm sure we can cover this. And I'm very pleased to welcome 4 excellent distinguished speakers representing this morning the diversity and the breadth of the health sector. So warm welcome to Dr. Ina Kelly, representing the Standing Committee of European Doctors, CPME, and also the Irish Medical Organization. Warm welcome also to Panayotis Chaslaridis from the European Federation of Allergy and Airways Disease Patients Associations, EFA. Warm welcome to Pascal Garel from HOPE, the European Hospital and Healthcare Federation. And last but not least, warm welcome to Christian Horremans from the Independent Health Insurance Funds in Mutatil Libre, representing here this morning the AIM, the International Association of Mutual Benefit Societies. And indeed, if you could, leave out the slide so that we can all see our speakers, our panelists, that would be much appreciated. And I wanted to kick us off because we heard a lot this morning already on the need for the healthcare sector to be active on climate, both on adaptation and mitigation. So I wanted to hear from our panelists this morning, why is climate resilience relevant to your organization and to the sector that you're representing? And what is the role of your organization? What are you concretely doing on strengthening the resilience? And we'll start with you, Ina, first on speaking about how doctors have been active on climate resilience.
Thank you very much, Anne. Well, I suppose the CPME, that's the Committee Permanent de Médecins Européens, Standing Committee of European Doctors in English, has been really active in the climate change area for quite a while, and it's recognized climate change as one of the biggest global health threats of the 21st century, and because of the adverse effects on physical and mental health and reduction in quality of life and other health consequences as well. And so it's had a policy since 2009 on global warming and health. And I suppose it's really encouraged doctors to be both prepared and respond to health threats, and also to advocate about the health risks of climate change and the benefits of action. And the more recent policy in 2023 then is really pushing doctors, or highlighting the doctors have a key role in raising awareness. So it's really important that doctors are actively advocating on behalf of climate change among both their patients and the public and policymakers. And I suppose, again, also reminding us that as healthcare, we're a big emitter, and therefore we need to be very active in trying to achieve net zero emissions and to actively work with that as well. And so that's from the CPME perspective. And I can speak, say, in the Irish perspective as well, because that's in the implementation side. The Irish Medical Organisation, and I'm sure all the other medical organisations across Europe, are very involved in doing this type of work. And, you know, the Irish Medical Organisation is involved in the Climate and Health Alliance, which is very involved in working with all our allies across the system in working towards improving, you know, air pollution and active travel, but also, you know, talking about food systems and so on, and the way things impact on health and climate change. And then as my normal work, my day-to-day work as a consultant in public health medicine, in trying to protect the population against the impacts of climate change. So I work in our health service climate and health strategy. And so we're very, very involved in trying to bring adaptation across our health system, which is, you know, obviously it's a very huge task, but actually we have a plan and we're working towards it, and we have to tackle each and every issue that's going. But in the long run, we need to mainstream it so that everybody's acting to develop resilience to our climate change. Thanks for the moment. I better finish, let somebody else speak. Thank you.
Thank you very much, Ina, for this kickoff and showing how doctors and doctors' associations have been active. We would now like to turn, or I'd now like to turn looking at the patients and how climate and health or climate resilience is being dealt with as part of EFA's work. So over to you, Panayotis.
Good morning, and thanks for having me in this beautiful panel, Anne. Thanks for the previous presenters for their really good presentations. As they were very clear about it as well, today it's simply undeniable that climate change takes a huge toll on human health. Those living with allergy, asthma, or other respiratory diseases, like the community that I am representing, experience worse symptoms. Under normal circumstances, the climate emergency is not an abstract phenomenon to patients anymore. Heat waves make breathing difficult for people with respiratory conditions such as asthma and chronic obstructive pulmonary disease. Increased pollen exacerbates symptoms such as runny nose and itchy and watery eyes. Increased pollen also is a result of higher temperatures, while floods that leave behind allergenic mold can also worsen allergy and asthma in general. According to a Eurobarometer survey from 2023, to which Peter earlier referred to, 2 out of 3 of EU citizens think their government is not doing enough to tackle climate change, while more than half believe their government is actually responsible for it. That's why IFA actually gets similar messages from our allergy and asthma youth group, where our members from various European countries tell us that they don't feel climate change is seen as a priority in domestic policies. That's why at IFA we place a lot of attention on climate change as one of our most imminent threats we face. For the patient community of IFA, heat wave becomes a matter of life and death, actually. For example, France reported more than 10,000 excess deaths during the summer heat wave of 2022. And to bring the struggles of vulnerable groups into policies, IFA now has a climate change program, and we work closely with our 45 member associations on relevant issues. Moreover, IFA facilitates Keep Breathing campaign, a multi-stakeholder campaign that brings together the respiratory patients and healthcare professionals in a unified vision for lung health in 2024-2029. And you can see the logo of the campaign here on my back. So together with the actions and initiatives of our members at national level, which are very, very active on climate change issues, IFA is developing a multi-level, multi-dimensional activity across the board. Thank you very much.
Thank you very much, Panayotis, highlighting how patients and patients associations are engaged and shows that it's a great level of concern. I would now like to turn to Pascal and hear from you on what hospitals are doing to strengthen climate resilience.
Thanks a lot. Thanks a lot for the invitation. Thanks also for colleagues who already spoke. So a lot has been said already. It's obviously very important also for us. I must add also that it has to several other pressure factors, aging patients, aging workforce, the austerity policies, etc. So it's an additional issue we're facing, and heat waves had been mentioned already. But yeah, in the last 2 decades, the heat-related mortality has increased by 30% in Europe. So behind those crude figures of death, there's a lot of care needed at home, in residential home, nursing homes, and also in hospitals. So it's clearly a very important thing. So what we've been doing for the last 15 years, and it's quite recent somehow. 15 years is very, very short. On the adaptation side, you must understand that it is an institution, the place where doctors and the 200 other professionals meet patients and carers and families. So what we've been doing is to come back to some examples. We've been working on a research project to support research projects on several resilience aspects. The most recent finished project was Periscope, which was on pandemic resilience. But we're working also on 2 other projects where resilience is as a core of the project. I've seen on the chat there's a question on financial. Yes, we are with a project called Flash, looking at financial resilience, not only on climate but on other aspects as well. We've been working on patient safety with Safest, where also we have added this aspect of climate change as a very important element. Also in relation with this very nice and whole network of health promoting hospital, which is also a place where you find a lot of activities in that fine. We have been monitoring, and it's our role for our members, we have been monitoring what you find or not in national reports on the existing health recommendation. And there's still a lot of big gaps, as was shown before on this. And because we try to be positive, also to exchange on good practices that have been identified in several countries. It again is a core element because, as I said, we are buildings, and of course we are not zero net impact buildings, although there are some built nowadays, but some of our buildings are 19th century, even older than that. So heat waves is a big issue, and you cannot count on the 1% zero net emission building to help all this. And so finding good practices is a very important element for us. Mitigation is also important, and it has been mentioned already about the impact on the health sector. We represent 10% of GDP nowadays in average in Europe, and the emission, yes, it's a little bit lower than that, but not anyway. It's a huge task for us also to identify where a recent study of the French Society of Anesthesiologists showed that 40% of the emissions seem to be in the operating theater or around the operating theater. And that's also a very important element to try to see where the change has to take place. So we follow and work with organizations like NHS England, with the SHIFT project in France. Also, the Paris Hospital Group has done a very, very nice work of first of all trying to know where is the impact, and so that we can act. And already a lot has been done yet. So I stop here because I think we can continue on this later.
Thank you very much, Pascal, for this kickoff and highlighting already some of the good practice. Indeed, that's part of the aim also of this morning, is to highlight the good practice that's already out there and to see how we can also join forces and even take the next step in good practice and in working together across the sectors. Last but not least, I would now like to turn to Christian to hear from you, representing the not-for-profit health insurers, on what AIM, what independent health insurance have done to strengthen climate resilience.
Thank you very much, Anne, for your kind introduction. Happy to be here, so thank you for the invitation to be able to participate here today. As you might know, AIM represents 49 members from 26 countries. So those members, they provide health coverage for 240 million persons in Europe. So it's evident to understand that for us, the impact of climate change as one of the major health risks is an important issue for us as a mutual organization. First of all, we want to contribute to protection of our members. And as several of us said, it's a major health risk for all of us. And that's, for example, why AIM has been very strict in underlining the importance of climate change in their memorandum for the European elections. From our side in Belgium, we also have federal and regional elections in Belgium. We have taken the impact of climate change and environmental pollution as one of the 7 big challenges of the Belgian healthcare system and public health. So we try to mobilize and create awareness during this election time. What is also important, as we have members, so we have a direct relationship to our members, so we can inform them and create awareness towards them, like what is happening, inform them about studies, about things they can do themselves. So that's one thing, protect the health of our members. Second thing is that a lot of mutuals are involved in the social security systems of their country. Like, for example, in Belgium, as a mutual, we are co-managers of the compulsory health insurance. And so it goes without saying that climate change and environmental pollution has a major financial impact on the compulsory health insurance. And that's why, for example, we made a study 2 years ago on the impact of air pollution. And we all know that there's a close link between air pollution and the climate change, or the higher temperatures. So with this study, we showed that, for example, if everybody in Belgium would live in a neighborhood with the lowest concentration of particle pollution, well, we could save up to 43 million in GP visits only. And that's 37 million only for compulsory health insurance already. We also saw that people living in neighborhoods with at least 30% tree cover, they go less often to the doctor. So that's also an important observation when we talk about climate change and how green zones and blue zones in cities can help to reduce the health impact of climate change. So for Mutual, it's important to have a climate resilient healthcare system, and to make sure that we continue to offer qualitative healthcare to our members and to the citizens in general, and also that this transition is financially sustainable. So those are the main aspects where we focus on from the Mutual side. Thank you.
Thank you very much, Christian, for highlighting the costs also associated with what we're faced with in health and climate change, which are also prevention opportunities, of course, and then also talking about finance, which leads me right away to my next question for the panel. And it's also something that was asked by participants here, and that is about the financial support that you have identified you need as organizations, as part of the health and healthcare sector, because obviously we have heard that there is a lot of engagement already. There is a high level of awareness, Many doctors, patients, hospitals, health insurers want to be active. They have been active, but this obviously can't happen in a void. This needs support. So my question to you, very tangibly, what kind of financial support is needed, and what kind of other support is needed from your respective national governments or from EU policymakers? Ina, if we could start with you.
Okay, thanks very much. I think that, I suppose, funding comes from governments down to divisions in our society, like ministries or departments or whatever. And I think that one of the problems there is that they don't have health on their agenda for most of them. So in reality, there's very little funding for cross-sectoral working. And I think that's a barrier in its own right, because unless really people are funded to cross-sectorally work, most of the health issues arise, the health issues arising in the environmental sectors and the different government departments that produce environmental conditions that actually make people vulnerable to climate change, whether it's to do with housing, whether it's to do with building regulations, and flooding and so on. And I think that governments, I suppose the way that they fund is a problem, and then the amount that they fund is a problem. Now, I know Evelyn mentioned about One Health in all policies rather than health in all policies. I'd say maybe both, really. Health in all policies is a WHO recommendation. I would still stick to that, and I don't think it's being implemented. I don't see it being implemented, and therefore I think that if it's funded, it means that intersectoral work would need to be funded in its own right, where there's actually where people who are working in, say, the environmental sectors are thinking about health as well, and have it's on the legitimate part of their work. I think the strengthening the climate resilience of our health systems. I mean, obviously we need to do plans. In the first place, we need to recognize where our vulnerabilities are, and we need to be prepared and to overcome those, and those all need to be funded as well. So they need to be endorsed by government, and where the money to actually implement those plans is it's where there's costed and actually ring-fence budgets for that type of work. I think investing in prevention is a terribly important area, and if prevention is not seen as attractive, I think very much. I think it's much easier to spend money on big projects that have lots of photo opportunities, perhaps. Prevention is seen as a bit boring and maybe not so exciting, but actually it's probably the most sustainable healthcare that we can do. And we need to, I suppose, maybe make it look more attractive by recognizing that putting money into these areas is going to save. And I know one of our panelists here talked about costs of GP visits and all of these other things that are really maybe potentially preventable, and operating theatres. Which of the events that we see lots of and that are going to increase are actually potentially preventable, and working our way back to actually prevent those things. That's really important to invest in. But I think it's very rarely on the agenda, because it's sort of invisible work, and it's not seen as very exciting, and it's very, very rarely talked about very much. So I think that's an area in which we need to be really building up the profile of the value of prevention. And then I think that we need to make sure that people are trained. Training costs money. It's important that the funding for training is across the system, so that all of our people who can make decisions are actually trained to understand the impact of the work they do, whether it's on health or climate change and so on. And I think that's important that those are funded properly. Epidemiology is important. We can't really make decisions without data, so it's really important that the climate epidemiological methods that we can use are actually funded really well, so we can watch to see what's happening and make sure that we can try to prevent it, but also recognize new trends and new risks. And then I think regulatory requirements need to be funded as well, like sustainable procurement of pharmaceutical products and so on. I think somebody has mentioned that in the chat as well there about plastics and so on. It's really important that all of the really big emitting issues, but also the big resilience issues, are funded. But I think unless the funding parts of our system, of our government, actually recognize and understand what adaptation is and what they need to be doing, and I think working together is critically important. So prevention, intersectoral collaboration and so on, they all need to be funded. Thank you.
Thank you very much, Ina. So what I hear from you is very much a need to boost, to significantly boost funding in all the different areas you highlighted. Pascal, is this also your experience? You mentioned previously that many of the hospital buildings are old and that they're faced with significant challenges in heat waves. So where do you see the greatest need on stepping up financing?
Thanks. First of all, on the positive side, I would say that there's a very nice report recently published that was commissioned by the Belgian, Austrian, and Slovenian Ministries of Health that has been looking at the EU funding. And one of the story was about EU funding of greening healthcare, and it was the Austrian case. So there's a place now we can see where the EU funding could finance greening healthcare, and that's a very good, interesting report. So I advise you to read that. But there is a big but. There's a recent study of the New Economics Foundation recently, it was in April last month, that was looking at the social investment needed in Europe. And actually the European Commission has its own figures, and it says that European healthcare needs 120 billion a year investment if we want to keep up with things. But the New Economic Foundation shows that the majority of EU member states with the new proposed fiscal rules would not be able to cope with that. They even calculated that when you include green investment in our sector, in health sector, there would be only 3 member states that would be able to invest with this new fiscal capacity. So it's not decided yet, but it's an important things to mention when the elections are close, because yes, of course, we need hospitals, whatever. I mean, yes, prevention is a huge thing, but I think maybe the society, the way it works, should change a little bit before preventing things that the society creates. But hospitals are there and they are needed, so we need to invest in them, and that's really worrying, because one point is, yes, there is EU money, but it will never fit this huge need. And the money is, well, at national level or regional level, because we have in Europe, the vast majority of countries decentralized. So the decisions are taken at different levels. So we have really clearly an issue, which is not limited to climate, but should be integrated in all the other issues in financing the investment and the healthcare sector.
Thank you very much also for rephrasing it to talking about investments, because I think that's a key aspect. Too often we think about these in terms of costs, but actually no, it's investments in health that need to be taken, and on indeed highlighting where it's really a burning question that a lot more investment needs to happen. Panayotis, I wanted to turn to you from the patient's perspective. Where is the greatest need on resources, on financial support?
Yeah, thank you. So obviously, strengthening and improving the resilience of the healthcare systems is an absolute is very key because legislation both at EU and national level is powerful only as long as it is underpinned with strong funding, which is a signal also for commitment. So financing adaptation is absolutely linked with a concept of secondary prevention for our community, especially if one thinks that such a strengthening can actually offer plenty of co-benefits. So better coordination between primary care, secondary care, and civil protection services to address the situation of the most vulnerable, which is also urgently needed. So yeah, that's quite important. What is also important is awareness, and we can see clear gaps there according to several Eurobarometer studies on climate-related risks, such as air pollution, for example, where about 60% of people are not well informed on the quality situation in their own country. So targeted campaigns addressed to policymakers, the healthcare sector, vulnerable groups, as well as the broader public are also quite important from our perspective.
Thank you very much. Christian, how is it from your perspective? You mentioned financing. Can you elaborate a bit more on, from the health insurance perspective, what is needed most when it comes to financial support?
Well, I'm very happy that the word prevention is being mentioned by everybody around the table, and it is a focus point, and sometimes it's a bit forgotten. I'll give you the example of the National Environment Health Action Plan and the NEHAP that was mentioned earlier. So it's in Belgium, the plan to try to, one of the actions is to try to make the healthcare system more resilient. It's focused a lot on the hospitals, and it should, but on the same time, we're forgetting about certain opportunities. For example, the use of green and blue zones in cities in times of climate change is not even or hardly mentioned, while we should also invest in prevention. How can we avoid to have more patients going to the hospital because of cardiovascular problems due to higher temperature, for example? So as somebody spoke about integrated response, I think that's an example of how you should be focusing. And in Belgium, I think that's a bit of lacking in the National Environment and Health Action Plan. As you know, in Belgium, it's a complicated structure. We have a federal level, we have regional level. We need to agree on financing and who pays for what, and that's a bit of a let's say a difficult point, I think, also in the action plan. That's not a really clear image of which budgets are at this moment disposable for or there to be used for certain actions. What is maybe also interesting to mention is that there's something like the Social Climate Fund, and we spoke about just transition. I think that's also a way to integrate that in this integrated response, that you can use that money, for example, for deprived persons living in energy or transport poverty. And it contributes to making, for example, the air quality better and so on. So next year, the member states will have to introduce a national plan and to ask money from this budget that represents 86 billion euros. So that's a lot of money. That's also a way to contribute to making the system more resilient by looking at the other domains that can contribute to making things more climate resilient. Thank you.
Thank you very much, Christian. Also highlighting how, the many areas we as the health sector need to be engaged in to ensure we strengthen climate and health resilience. For example, just transition, as you mentioned. To conclude this part on financing, I wanted to see if Peter, you could take the floor and highlight some more of the EU financing perspective. Also, since this was asked as a question, and we heard from Pascal, there was a report. But if you could point us to some ongoing EU initiatives, or also talk about future ones, as we have heard from all our panelists now that there's a great need for further financial support on both health adaptation, but also mitigation. Over to you, Peter.
No, thanks for giving me the floor. Yeah, I did raise the issue of financing as something which is a stumbling block across all sectors of adaptation. I brought myself in a difficult situation here because I'm not our finance expert in our team. But what I can say is that both in the EU climate risk assessment and our communication, there are dedicated chapters on these matters. And advised already Dieter from Politico to have a look at these. And I would also be happy to bring in our financial experts in future exchanges on these matters. What I can say a bit is I fully agree. I think in our analysis, I mean, there is no way that public funding would be enough to cover all the needs in the sector. We will need private sector investment, and of course investment it's got to have a payback, and how do you sort of square this with the need for prevention? That's a very difficult one. We have a resilience dialogue with the insurance industry and the banking sector, and I think these are the people we will need to bring into these debates too. And we will have later this week, actually, our in-person partner meeting of the European Climate and Health Observatory this year, and we will do the work plan for the next 2 years. And I expect also discussions on how do we resource these measures. I mean, I think there is a growing agreement on the types of measures that are needed and what needs to happen, but how do you resource this, and how do you mobilize those and control of those resources? And I think this is a completely unclear question for me for the time being. Something else which I think is across all sectors is, and this is also what we say in our communication, is we do have still a fairly shaky understanding of how climate change affects the international European financial systems and the financial world. So this is, there are important data and knowledge gaps still in the field. So it's the impression, again, as speaker as a non-expert, is it's a very challenging field. I don't think we can solve it just in the health community on our own. We will need people such as AIM, the mutual health insurers. We will need people like the EIB. We will need the insurance industry around the table. We may just like in other areas, we will need to look beyond health and look into other sectors. And I think the impression which I get is we were just at the beginning of this dialogue. So it's great that we have it, and you raised it in this webinar, because I think this is, if we don't make progress here, then how on earth are we going to do what we want to do? And I think we are, as I said, the measures are relatively clear. We have a political mandate. We've got big wish lists in the Budapest Declaration, the COP28 Declaration, but the resourcing is the big elephant in the room. I think that's all I can say really on this matter at this point. Thank you.
Thank you very much. That was very helpful indeed in pointing out the need to have these intersectoral conversations and exchanges. And on the resourcing, I actually hear potential future webinar in all of this when it comes to climate and health financing, really bringing as you say, the finance community together with the health community and talking about it. So that is duly noted. I would now like to turn our panel to talking about the broader political support, because obviously ahead of a decision to resource a certain activity needs to be an agreement and understanding that these health adaptation and mitigation activities are a priority. Peter, you pointed out the health risks in the UCRA report, and you also showed us a slide on some of the EU policy measures that have been taken. We are 3 weeks now ahead of the EU elections. We're looking at the next EU policy cycle, and on some of the discussions that we have been seeing on the EU strategic agenda among the EU heads of states. HEAL and many other health organizations were actually quite concerned that overall climate action, not speaking about health, but climate action was barely mentioned. Actually, health in the draft EU strategic agenda is not included. It's very much focused on security, on competitiveness, while I think this panel would agree that these are very much, both these names or concepts have very much health at the center. So I wanted to turn to our panel and ask you, looking ahead now to the EU elections and beyond, looking to the next EU policy cycle, what is actually needed from your perspective to strengthen climate resilience? And I'm going to open it and see who of our panelists would like to go first on this question. Any volunteers? Christian, please. Yeah.
No, I'm happy to volunteer to start on this point, because indeed we share completely this sense of, you could say shock when we first read this strategic, or the proposal of strategic agenda for the coming years, and the fact that the word health was not mentioned and climate hardly between the lines, and environmental pollution was not even mentioned. So that's why last week we published a press release in which we asked that not only the Belgian government but other member states should really put climate change and environmental pollution and health on top of their list, because we really need this sense of urgency. I think all the figures that have been mentioned before by Peter and Evelyn should wake up everybody. For those who are still sleeping a bit in the back, really need a sense of urgency to put it high on the agenda also the coming years. And we need, well, brave politicians to do so on national level, but on European level, and politicians that are prepared to tell the story as it is, and make sure that they make understand that change is necessary, that we use science, that we can use technology, but that change is necessary. And that sometimes it might be take tough measures, but we need to go through this transition phase. And we need politicians to explain well why it's necessary, what is necessary, and that we have objectives to keep in front of us, to make sure that in a couple of years we don't look back and say, oh, too bad that we didn't think of that in 2024, just before the elections. So we need to have people to also bring this message more towards the citizens. And when somebody's protesting, it's always easy to, how should I say, to take a measure away, or to say, okay, maybe we'll postpone it a bit. That makes it a bit easier for everybody. I think we should really make sure that this change is put on the agenda, and that everybody is committed to it to make this change happen. Thank you.
Thank you so very much. Continued need to raise our voice as the health sector, and if you want to educate policymakers and the public on what is needed. Ina, you wanted to come in next.
Yeah, I think a transformational change is what's required, and I think that therefore, we often just do things incrementally, adding little bits, and I think it's really vision is required from our European leaders in relation to a more, I suppose, sustainable and resilient Europe. And I think that part of that is for us, I suppose, to be encouraging and supporting, and to speak and to support I suppose maybe to support politicians who maybe need to be brave, as Christian has said. And I think that maybe we need to be collaborating with the political side to encourage them and to tell them that they're doing the right thing when they are doing the right thing, and to make sure that it's visible, that the health issues are visible. I think in the long run, it needs to be on the top of the agenda, and we probably do need to speak out more frequently and speak out more volubly on that, and I suppose, but support and encourage as well. I think that targets are very important. That that we've already set and we've already agreed to, that we keep, highlighting gaps and so on. And I think that I think a lot of it though is about I suppose maybe information as well, misinformation and disinformation, which is a big challenge across Europe. And I think that there's the anti-scientific, lobbying and so on as well, that somehow or another, I think we've got to work together to bring the scientific messages to the public, and to I suppose to provide reassurance that following a pathway to a climate resilient future and a sustainable future is actually a better path for all. Because I think a lot of the misinformation and disinformation is around fear, and I think somehow or another we've got to find a positive, hopeful message, but also an active message about doing the things that we know need to be done, that will also address inequalities and bring people together, rather than supporting adversity and fighting among ourselves, which of course doesn't achieve anything. So I'm not exactly sure how any individual one of us does it, but I think as together as groups we can do better, I think, and to try and to again show the way forward, and I suppose to work towards it ourselves as well. Thanks.
Thank you very much, Ina, again highlighting why, as the health community, we want and need to be more vocal, and as you say, bringing forward the science, but also bringing forward the evidence on the benefits to our health from action, from climate action. Panayotis, your view. What needs to happen at EU level?
Yeah, thanks a lot. Thank you very much. I would like to actually voice also our big surprise by reading this report from the Council, which gives this disturbing feeling that climate change is a challenge of the past or something that we already dealt with during 2019, 2024, and then now we need to move on. It's not like that. It's something that it's a continuous thread that needs continuous effort in the future. For IFA, it's clear that we need a shift in how we view the climate change threat and health. Disease prevention must become a clear priority, and setting ambitious climate targets and supporting research on climate and health at the EU level is a necessary first step. UCRA actually takes an important step to this direction, identifying key risks and putting the urgency level into perspective. We cannot afford anymore to ignore risks and their impact on health or to be complacent. What we need, and this is actually another clear takeaway from UCRA, is urgent executive action. Climate change presents all the features of a cross-border health threat, and it must be dealt with accordingly. The EU can set the tone on aspects such as, for example, early warning systems for heat waves and pollen concentrations. These warnings can in turn be used by vulnerable groups as a guide to organize their daily activities accordingly, for example, by avoiding outdoor activities during peak hours. But there is also a broad palette of actions that can help tackle climate change and its effects also at the national or even local level. There is a need for an adaptation policies that are for the whole of society, including civil society organizations as operators, but also disseminators of the change. At the EU level, we feel that Commission services could coordinate a bit more. As we know, health is a high demand from citizens, and same is climate change action, and both can be combined. The benefits for health are huge for the population, but also to reduce public expenditure, as we discussed a bit earlier. We cannot lose, therefore, sight of the urgency to act. We need to continue with renewed commitment in the next mandate, advancing knowledge and awareness, and engage more with civil society, including the affected and the most vulnerable, such as patient organizations.
Thank you very much, Akis. Also bringing forward the need to have a perspective on vulnerability and have an inclusive approach. Pascal, from your perspective, for the next EU policy cycle, is there a lack of understanding on the urgency to act for climate and health resilience?
Certainly. Unfortunately, the fact that health is not included is not a surprise because we've been through that before. Those of you who were there in 2019 will remember that the big discussion at that time was to know if there will still be a Directorate General Santé. Thanks or whatever, COVID, of course, we stayed there. But that's unfortunate because the treaties include this concept of health in all policies. That is very WHO, but it's there. It's in the charter. We went through the manifesto of the different European parties, those who had a manifesto, and it's not very exciting, but there is one, I will not quote, of course, which party is doing it, but it's saying health is a public good to which everyone has a right. Yeah, it's in the treaty. So why is it not that high on the agenda? So yeah, it's up to you, the very fragmented world of health care at European level and national level. That's us also to bring the message. Just anecdotal, we never ever met the Commissioner for Health, despite many tries. But the first person we met was the Commissioner on Environment, and that was very fruitful. So our message, yeah, let's go to the different DGs and commissioners when they arrive, and of course to European Parliament to bring this message, but together as a group, as a European stakeholders. That's clearly what we have to do, at least in Brussels and hopefully also at national and regional level, because that's how things are moving. If they see us from the sector patient professionals institution together, well, maybe that make them think more.
Thank you very much. We're almost at the end of our webinar, and I wanted to already thank participants here for highlighting reports, for putting in links to reports, to briefings, for also giving your perspective on the topic, and also including questions. We will not be able to answer all of the questions. I did want to end our panel discussion here with a positive outlook. And ask you actually about good practice. And this can be good practice on intersectoral collaboration, or collaboration among different organizations in the health sector and beyond, as we've heard a lot this morning on this need to overcome silo thinking and to bring everyone together and bring different sectors and perspectives together. So do you have good practice that you can share this morning, something very tangibly? This can also be something from the local level, as we had a question here on how can we actually achieve this adaptation and have plans and measures at the local level. Is there something you can share with us here this morning as we're about to close this panel? Who would like to start? Ina, do you have a good practice for us?
Okay, thank you. Well, actually, on my day-to-day job, as I said, I chair our adaptation and resilience working group in our health service executive, which is the main health, it's a sort of our national health service in Ireland. And we have a number of, I'd say not fully, we don't have all the different actions that are required, but we have a very significant, majority of the types of actions we need to start adapting to. One of the things I'm sort of familiar with, don't become adapted, you are adapting all of the time, because of course the risks are going to keep maybe multiplying and changing and so on as well. So you need to be in an adaptation framework rather than and so on, rather than actually you never achieve it fully, and you only know, I suppose, becoming resilient is when something doesn't happen rather than when something does happen. Probably insofar as when something, like say if something gets flooded or a health service gets flooded, that wasn't a resilient service. But when it doesn't get flooded, you don't quite know. So that type of thing. So we're very involved in working with our capital and estates of the buildings, and we're very involved with the cancer control program on UV exposure, which of course in Ireland we were very vulnerable to skin cancers during hot weather and being exposed and so on, and air pollution. And we work with colleagues in all of these different areas on trying to make our system more resilient. Now we've a long way to go, I think, insofar as we haven't suffered heat waves very much in Ireland in the past, and I don't think we have much excess excess mortality related to heat waves so far because of our latitude, but that may be coming down the line. We are starting to recognize where our vector-borne vectors are. We're doing some monitoring of them, but again we have a lot of work to do. But so we're sort of measuring what's our current baseline, where are we at the moment, what do we need to do. So we're very active at actually recognizing where our vulnerabilities are. One of our big issues in Ireland is that we have the highest rates of viral toxigenic E. coli, or it's called STEC, I think, in many countries. We have the highest rates in Europe, and probably related to our, partly to do with we have a big reservoir of cattle because we're a dairy country, and we have a big industry, and then we also have a lot of karst limestone through which our water flows, and then lots of unregulated water supplies where people have wells and they're probably vulnerable to contamination. So we're doing a lot of work in that area, but there's plenty to do, and probably will continue always to have plenty to do. But I think the first thing I'm very heartened by is the fact that so many areas within the health sector are aware of the type of issues that we need to deal with. But again, funding is probably an issue that we're going to have to work harder at persuading our government to make sure that we have enough to mainstream the learning throughout our system as well. Thank you.
Thank you very much, Ina. Thank you for highlighting the good practice in setting up working groups, and also if you want doing a comprehensive assessment as a starting point of what are actually the issues we need to be looking into as we want to strengthen climate resilience. And Peter, you pointed out that indeed the EU Climate and Health Observatory serves as a good practice, as it is aimed at bringing together and strengthening intersectoral collaboration. Who else on our panel has a good practice, something to keep us hopeful? Pascal.
Yeah, we have on our website collected a lot of good practices at very different level. Local hospitals, nursing homes, etc., but also regional level. And so you can find them. In addition to that, last year we did our OPE exchange program. That is an OPE exchange program is existing for more than 40 years and brings together 140 participants. They go 4 weeks abroad, collect best practices, and present them at the end. And it was in Brussels last June, and the report is there. So it's full of at least 3 best practice per country, actually, mostly on mitigation, but you will find also on adaptation examples like that. So, and it's a wealth of information. It's sometimes anecdotal, small examples, but it's very rich and very positive.
Thanks very much. So that's something we will look into. We also we will compile the many links and good practice that was also shared in the chat. Thanks to everyone who participated. Christian, good practice on intersectoral collaboration. And if you could give a short answer, sorry, because we're almost at the end.
Well, the good practice and what is very hopeful is that people from or organizations from areas where before we never had contact with are reaching out. So there are really walls falling down. For example, organizations that are involved in car sharing contact us to see how we can work together on environmental issues, but also on the topic of climate change. So there's a lot of positive energy between organizations, mutuals, but also NGOs, associations. So that's very positive. I think what's very important also, and several mutuals are show good practice in that, is to walk the talk. If you come with a narrative on climate change, environmental pollution, of course, as an organization, you also need to make efforts yourself. It can be your building, it can be your car policy, and so on. So many mutuals are occupied with that, and that in some way is also a good practice, because if you preach, you also need to back up what you're saying. Thank you.
Indeed, thank you. Preach what you're praying. Akis, Panayotis, over to you. Last but not least, from the patient's perspective.
Yeah, thank you. So I can point to only a few cases, for example, regarding Poland, which we know is exacerbated by extreme heat. We have the case of several of our members, which together with other social actors, they managed to either set up or maintain national systems of pollen monitoring and pollen-related advice. So this has helped a lot of people, but again, it's at the national level. This is something that we believe we need at the EU level. And I agree with Peter that the ECHO, so the Climate and Health Observatory, is a quite important step in bringing together knowledge and advice. We believe that actually ECHO itself could help bring forward national best practices more and more in the future.
Mm-hmm. Thank you very much. So we've come to the end of our webinar. I think it was an incredibly rich exchange. We touched upon many aspects of the topic we're talking about today on climate resilience and how to strengthen climate resilience. I now have the difficult task of concluding today's webinar. So I will keep it very short, also because we are running out of time. We're at the end, but also you will be able to watch the recording. You will receive the slides and the information that was shared today, so you can take a further look into what was discussed. I wanted to leave or conclude with 3 messages on the topic that we discussed on climate resilience. And the first one is really that we need to see a recognition of the health threat in climate change, in the climate crisis that we're faced with, and then correspondingly, in understanding or an agreement of the urgency to act, both on mitigation and on adaptation, because it's also become very clear this morning that in order to strengthen climate resilience, we need to say action in both, in the adaptation, but also in the mitigation sector. The second point is that we need to see an increased financing for health and climate action in a just way. You've heard examples from our distinguished speakers and expert this morning that we touched upon. We also said that we do want to have a continued conversation, or actually an increased conversation, with the financing community. And I would add here one aspect that we didn't have time to talk about too much, and that is that we need to see target financing on inequalities. As we heard this morning, that everyone is at risk from the impacts of climate change, but we also know that some are more vulnerable than others, and these vulnerable groups need to be our guiding star, and they also need to be the, if you want, guiding star for targeted financing. And last but not least, third point is that we need to work together. And I think this webinar this morning was already an uplifting and inspiring example of how the working together happens in practice, on the working together between the different organizations in the health sector, in the healthcare sector, in those all of us concerned about the health and protecting health in climate change and working for prevention, but also overcoming the silo approach, because obviously there's also a whole climate community, there's also a whole financing community, there's an environmental community. So there's very much the need of all of us to work together, to have a conversation, to have a holistic and an interconnected approach that Eveline has pointed out in her presentation earlier. The topic we discussed today, strengthening climate and health resilience, is an urgent one. And so at the closing, I would like to encourage all of you today here to continue raising awareness on climate and health concerns, on why actually health needs to be at the center, health protection and actually the prevention of disease needs to be at the center of any action on climate, be it adaptation or be it mitigation, at all the different levels that we're faced with, at the EU level, at the national level, at the local level, but also at the international level. And I want to conclude by highlighting, it was mentioned earlier, we're at the start of a next EU policy cycle. We have the EU elections coming up in 3 weeks. So I want to invite all of you to go out and vote and highlight that climate and health concerns need to be at the center and at the core of the actions that the EU will take in the next 5 years. Thank you all very much. I believe we have a thank you slide at the end. So I'd like to thank all our speakers and our panelists for their really excellent interventions here this morning. I'd like to thank all of you participants on being here this morning, on taking the time, and also sharing your perspective, sharing the evidence, and asking your questions. I would also like to thank very much our technical support, Wendy and Clementine. We couldn't have done it without you. I would like to thank the co-organizations and also the European Commission for hosting this EU HPPP live webinar. And I hope to see you again at one of the next webinars. Thank you very much and have a good rest of the day.